Bryonia is a remedy of membranes. Three main types of membranes Bryonia has action on are serous membrane, mucous membrane and synovial membrane. When you talk about serous membrane, you have pleura, the peritoneum and the pericardium. The mucous membranes of the respiratory tract, stomach and intestines. Synovial membrane, you have the joints. Now, the main characteristic of Bryonia is the dryness. Wherever there is inflammation, there is also dryness. In inflammation or in any complaints of Bryonia, the pains are mainly stitching pains. The pains are worse by any motion and the patient wants to lie absolutely still. Any motion, even slightest motion is unbearable to Bryonia patient. So they want to lie absolutely still. Also, they would like to press the affected part. So any pressure or touching or keeping the parts pressed is likely to give relief for the Bryonia patient. So that is why the Bryonia patient likes to lie on the painful side. Now thirst, with dryness there is also thirst. The thirst is for large quantities of water, but it is infrequent. If you look at the mental generals of Bryonia, similar to physical general, the Bryonia patient wants to be left alone. They don't want to be disturbed. Physically, the Bryonia patient does not want to be moved. Mentally, they don't want to be disturbed. They are very irritable. When you try to talk to them, they become irritable. Now, they have certain delirium. They like to talk about business. They have anxiety about future, more about financial stability. Whereas in Bryonia it is more about financial. In arsenic it is more about health. So the arsenic patients are usually very restless due to their anxiety. They are restless and they have this anxiety about health. Whereas Bryonia patient, they wants to be left alone. They don't want to be moved. Now moving on to spheres of action. So when you talk about serous membrane, Bryonia causes inflammation. So there is pleurisy, peritonitis or pericarditis. It can be pleurisy, it can be peritonitis and it can be pericarditis. Just as I talked about in the general characteristics, the pain is stitching pain. The patient doesn't like to move. They like to be lying still. And also they have better by pressure. So they will be holding the chest or abdomen to prevent any movement. That is in serous membrane. So now if you look at the mucous membrane, mouth, there is thirst. It is very dry. The mouth is very dry. And the patient is very thirsty. So this symptom you can consider it as a general characteristic of Bryonia. So maybe with headache, with fever, with cough, with the intestinal stomach, gastrointestinal complaints, you can find this thirst. Next is the mucous membrane in the lungs. It can cause dry cough. The cough is dry. Any motion will aggravate the cough. So be it talking, singing, laughing, anything, eating, drinking, all will provoke an episode of cough in Bryonia patients. Then constipation. The stools are large, dry stools. Constipation, you can find it in gastrointestinal complaints. You can find it during fever also. When it has inflammation of liver, again the same stitching pains and the same modality you can find even in liver complaints of Bryonia. Now if you look at the synovial membrane, here for acute arthritis and synovitis, the joints will be swollen. Here again you will find the stitching pains. The stitching pains, the same modality you will find. Aggravation motion, better by rest. If you look at the other spheres of Bryonia, headache. Bryonia is one of the leading remedies for headache. Be it migraine, be it sinusitis, the Bryonia patients can have headache. The pain can be bursting pain, the pain can be stitching. Again the modalities, worse by motion, better by rest, better by pressure. The Bryonia patient would like to tie something tight around their head. So in worse by motion, you will find that even the motion of the eyeballs is painful for Bryonia patient. Bryonia is an important remedy for mastitis. The breast will be hard and swollen and the patient wants to be supported. They will support the breast and they don't like any movement of the part. Eyes, in serous inflammation of the eyes also, Bryonia will be indicated. Bryonia is another important remedy for fever. Fever, usually it is low onset fever. Usually most probably it can start by morning. The patient may feel slightly unwell in the morning, then by evening they will develop headache and then they will develop the fever by evening. So in fever they have usually dry hot skin, no sweat at all. They want to lie still, there is irritability, there is aches and pains and motion, they cannot tolerate motion, they don't want to be disturbed. All that you will find in Bryonia. There will also be thirst for large infrequent quantities of water. So another, when I talk about cough, if the fever, along with the fever there is cough, usually the respiratory complaints of Bryonia are the ailments from or comes on when there is warm days, when the summer sets in after winter or spring, when the warm days starts coming in, then you can find the Bryonia cases coming up. So remember, Bryonia means membranes inflamed, dryness, stitching pains and the modalities are very important in Bryonia. So that's in today's Materia Medica deep dive. Subscribe to this YouTube channel and revise your topics by watching the videos.